Let's talk SEMH or SEBD. So what that stands for is social, emotional, mental health or social, emotional, behavioural difficulties. They're just lazy titles. They're lazy labels. These are the labels our children don't need, by the way. They're lazy. And let me tell you why. I've just come out and said it, and I appreciate that this might be really controversial, but let me explain why. When we give children these labels, and these are labels because they're not telling us anything about the child or their difficulties or what they need. When we give the child those labels, we are telling them they are less than, they are wrong. They have difficulties that we as adults are not working out what they are. So what do we need to do rather than give them these sweeping labels that put them into provisions that are quite possibly not suitable for them, or they get themselves a bad reputation or a bad name? So what can we do instead? What we can do instead is understand exactly what's going wrong for that child, because I can guarantee there'll be a communication difficulty somewhere. You get a really good speech and language therapist in there, someone like Libby Hill and her team, and you will absolutely understand where the difficulties are for that child. It could quite possibly be a sensory problem. It could be emotional dysregulation, nervous system dysregulation. The child could have ADHD, autism, trauma, DLD, dyslexia. It could be a wide range of things. And quite often, those challenging behaviours are all underpinned by an anxiety. And the more we label our children with things like SEMH or SEBD, the more we are not uncovering what the actual problems are. And those children are left not knowing what their identities are. And it brings about shame. It brings about trauma. It certainly doesn't make things better for them. So if you are working with children, or if you're a parent with a child who has a label of SEBD or SEMH, tends to differ between England and Wales, please ask for more assessments. Look at a speech and language assessment. Look at an occupational therapy sensory integration assessment. Look at getting an educational psychologist to come and look at that child. Because I tell you now, it's not helpful having generic provision for these sorts of children. They deserve better.